So my first question is for you. Right from battling Nipah outbreak, flood, and ongoing COVID pandemic, how was the state health department mentally dealing with this series of fights, one after the other, and also handling media criticism of the Kerala COVID management model, which was internationally and nationally lauded? All the appreciations were there, and there were also criticism. But how was the state health department mentally dealing with this? Over to
Yes,
you.
it was really, it was too difficult, but anyway, we dealt with it. I think Nipah outbreak, it occurred in Kerala, and the source is in Kerala. At that time, we are not aware of such kind of viruses, and it was a very hardship during that time. When I came to know that one of the family in one of our village is suffering with a particular disease or peculiar disease and severe symptoms, and they are singing, then I asked my doctors and my health secretary to inquire about that, and we sent the sample to a virology lab, and it tested positive for Nipah virus. At that time, it is not familiar here. As you know, Nipah virus occurred only 4 or 5 places in the world, 4 or 2 countries, 4 or 3, I don't know, 5 countries, I think so. And it occurred in Kerala. At that time, it was a hardship and it was a irritating or disturbing news for us. But we at once we decided we cannot hesitate, and we should have to act to contain that contagious virus, and we started our working. When I heard about the case is positive for Nipah, at once I rushed to Kozhikode, and we opened control room at once, RRT formed, and everything was arranged within 1 or 2 hours. And we started our working, and we have no protocol or standard operating procedure for the containment of Nipah virus. And you know that there is no medicine, proper medicine for this kind of virus, and also there is no vaccination, and it is a severe thing. But we didn't hesitate for a moment, and we started our work. We at once we started training, and also we formed the isolation unit in our medical college and proper meeting there. And we go to that village also. We make to make aware in people, to the whole population there. And at once we started contact tracing, and we started everything within 1 day, or the next day we are ready to act. And that is the lesson we learned from the Nipah virus, that to act at once, don't hesitate for a moment. And my health secretary and other officers of the health department started to having protocol and SOP for this, and everything we started as soon as possible. That is a very good lesson, and through that operation, we know that we are able to contain this virus within that small area, and within 40 days we contained Nipah virus, and only 18 people caught the virus, and 16 succumbed to death, survived after that. And the whole world listened to that. What did they do there? And the groups of people came here to study about that, and they understood that the quick action and the scientific method helped us to free from Nipah virus. And similar thing happened when the COVID-19 virus reported. Because of the experience from the Nipah virus, we were in each and every year, the next year also. The Nipah occurred 2018, but 2019 also we conducted mock drill. The scientists said that the Nipah virus will come next year also, and we cannot say that it is completely we are free from Nipah. It may come next year also. And 2019 we conducted mock drill in each and every medical colleges and district hospitals and general hospitals, most of the major hospitals. And we trained, we give refresh training to our health community, health staff, doctors, nurses, and even field workers, ASHA workers. We conducted training, refresh training also. Amidst the news of the COVID virus come, and when I came to understand that a potential virus is spreading in Wuhan, China, I at once remember the Nipah virus incident and what was the hardship we undergone at that time. And I feared, definitely, I felt some fear in my heart that this virus also will come to Kerala, because there are so many students studying in Wuhan, China. And I remembered that some of the medical students came to me before that for some internship and registration, etc. And at once I called my health secretary and asked him to have every preparation. I said that definitely this virus will also come to Kerala. He also agreed that, because when the students returned from Wuhan, definitely they were COVID virus carrier. At that time, little awareness was there about COVID virus. Only we understood that it is from the coronavirus family, like SARS and MERS viruses. It also belongs to coronavirus family, and also it is a highly infectious virus. But they said that the mortality rate of coronavirus is less than Nipah virus. But no use of that, because the infectivity rate is very high. And if more people infected by the virus, the death rate also increase because of that. That was an alarming news also. And at once we started preparation. And I think we came to know about this COVID virus on January 18th, 2020. We started our control room and all other preparations, 18 expert groups, everything on 24th January 24th, 2020. And we wait whether it come or not. Definitely it came. January 27th, the flight came from Wuhan, China to Cochin airport. And there was, I think, more than 70 passengers were there in that flight. But at that time, our trained team was there in the airport to screen the passengers whether they have any virus infection or not. And they screened, and we got 3 virus carriers or infected persons from these passengers, and we isolated them and treated well. At once we started to put our protocols and standard operating procedures this time also. My health secretary and all the team worked hard to maintain, to form isolation wards and everything. The 18 experts group were they were given responsibility to different activities: collection of the personal protection equipments, collection of medicines, and also the isolation ward, and everything was arranged, and training, and even mental health. There was a very good team under a famous doctor called Dr. Kiran, and our mental health team also activated, and they were ready to be familiar with the COVID affected patients and to give consideration to them, and to give them for a proper knowledge about this virus, etc. And we started our work. This means that there is no minute to miss or to waste in front of us. At once, we should start the action in front of this kind of any hardship. We should have to act as soon as possible. This immediate action, and we at once we formed our strategy for action. We have put forward this strategy. One is to trace, quarantine, test, isolate, and treat. The tracing the people, and next is to quarantine them properly. The other is to test the symptomatic cases and if it is possible, a positive case, isolate and treat. That was our strategy. And also we arranged the SMS campaign, that break the chain campaign, to break the chain of the transmission. That is the most important thing. To prevent the transmission, that is the important thing. The most important thing is to make our health system proper and strong enough to tackle with the problem. Our slogan is to keep the potential of the virus under the health system resilience threshold. And we improved our hospitals as soon as possible. We provide more beds, more isolation units, and also ventilators, and even oxygen supply, everything we start working. And we have a very good public health system in Kerala. And even we through the Ardhra mission, throughout the last 5 years, we were improving a health system, and we were converted the infrastructure of the health system changed a lot. That also helped us to addressing this virus. And I'm not elaborating this thing, but sudden action and proper action, scientific thought, and belief in science, everything helped us to tackle the problem, and we can reduce the mortality rate of COVID-19 pandemic to 0.5%. After this assembly election, and after the Onam celebration, etc., there is a rise in the case. But I think I am enthusiastic that we can contain, or we can control the virus as in the previous case. Previously, during the first wave, we delayed the peak, and also we contained the virus, and we flattened the peak within days. And this time the peak is going on. It is continuously. But I think if you act properly, we can another time also we can flatten the curve. And now also the mortality rate as a whole, average, it is 0.5%. And the lesson we learned from this virus infection is that if we work hard, work collectively, and work with enthusiasm, we can contain this kind of virus infection, and any hardship we can overthrow, or we can work over enthusiastically.
Thank you, ma'am. Thank you so much. I think it just set the right code for our discussion for the day. Taking from where Shailaja ma'am started, my question is to Madhur ma'am. Shailaja ma'am, politicians like Shailaja teacher are exception. But we all know not all politicians and political parties have kept the channel of communication to media open and accessible. This being the case, how did platforms like India Spend deal with challenges such as lack of communication by the government and access to data, especially during the ongoing crisis that we are all in? So can you please elaborate on that, ma'am?
Yes, thank you for your question. It's very interesting. And I must also thank Shailaja teacher for taking us all back to the early days of the pandemic. Fair bit of confusion for everybody, no clear information coming from any quarters. I think readers, journalists, policymakers, leaders like yourself, everybody was sort of in the same boat in terms of what information we had initially. So at India Spend, health being one of the main verticals that we cover, our focus in the initial days was sort of two-pronged. On the one hand, we wanted to help our readers understand what we knew of the virus and of the disease. And if you remember the early few weeks, there wasn't very much known. We did know there had been deaths in China, but it wasn't clear if this was going to become an epidemic and then a pandemic. It was a few weeks until it became clear that this was really going to be the story of our lifetimes as journalists. We'd probably be covering the biggest health story of our times at a time when a lot of us were also facing a lot of constraints in terms of where we could go to report from, whether we could go and report from the field at all. A lot of journalists, including in my team, had illness to deal with in the family, sometimes even deaths, falling sick ourselves. So the first prong of what we tried to cover was to understand and help our readers understand what to make of the SARS-CoV-2 virus as well as COVID-19 as a disease. So keeping abreast with the latest scientific research helped. There were regular bulletins from the central government, from the ICMR, talking about cases, talking about testing rates initially. These twice daily briefings kept a lot of us on our feet all the time. At India Spend, we ran a tracker for the first 4 months until almost everybody picked up on that, and other larger newsrooms with more resources to expend on a tracker took over. But until then, looking at the data and looking at the latest in scientific research was where we were focusing our efforts on. The other prong that we focused our stories on was the socio-economic fallouts, the health system fallouts of this pandemic. The migrant crisis is now largely forgotten, but it was a big, big story, and it should remain a big story because it's shown the light on a really less talked about aspect of our political economy. The disproportionate effect on women as workers. Women lost more jobs, but also were burdened with more care work inside of the home. Stories about schools closing and lack of learning, as well as malnutrition and related issues among children. So this was the second prong. How did we deal with the lack of information? I think this is when the media's role has really, really, really been important. We, like many other newsrooms and our sister concerns, have run fact checks to make sure that misinformation is tackled with a lot of alacrity and a lot of confidence. You have to react very quickly to everything and have all your facts communicated with clarity as well as timeliness. So that's been one really important role that the media has played in checking misinformation. There's also been a very enthusiastic, very driven cohort of journalists who've gone after the lack of data that we continue to face. COVID-19 India.org is going to shut down in a few months' time, and there's going to be a whole set of data collation that's going to completely go out of the public domain. We will not have data of various kinds. It's one thing to know just the case numbers and the death numbers, but to be able to make connections and join the dots to understand the context and background of what's going on, that's going to be a complete challenge all over again for all of us. So various crowdfunding efforts of this kind have been irreplaceably invaluable for journalists like myself, for our newsroom. Journalists have also kept up the pressure on especially undercounting of COVID deaths, including Rukmini S., who's written extensively for India on this, to assess the extent of undercounting, but also to understand the reasons for undercounting. We are not only alleging that the government is trying to hide the figures, that various state governments are trying to make themselves look good by not telling the truth. That could be part of the reasons, that could be part of the truth, but there are also systemic, longer-term, pre-pandemic reasons why the cause of mortality is not correctly recorded in our statistics. And we believe this is a really pivotal moment for all of us to learn from that and to make fix the loopholes that have been in our system, because this will provide us the data that we need on mortality from various causes, from various diseases, help policymakers expend efforts and resources on the diseases that are actually causing most mortality once we understand it a lot better, and then make things easier for all of us as individuals, as citizens, and as curious, informed voters. So this is, I think, does that answer your question?
It did. But definitely, I'm sure India Spend is a very important platform, very important source for we journalism teachers, especially for our data journalism class. And I'm sure our students who are listening to this conversation understand the significance of data journalism, especially in a crisis like this. Thank you so much. Thank you. So my next question, just to set the tone for the conversation, is to Mr. Prabhat Sinha. We have heard from the government, we have heard from media. We'd also like to know NGO, an organization like yours, Mandesi Foundation, which has been working in the area of health and women empowerment, what is the kind of challenges the organization is facing during the crisis, like NGO sector as such, especially those working in the area of health and women empowerment?
Yes, so thank you for having me. Really appreciate it. To be honest, if you would have asked me this question 2 years ago, I would have never been able to be on this platform and tell you about, like, I'm working in healthcare, or I'm working with the people who are suffering from COVID or things like that, because I've been an athlete my whole life. Then I've been a coach. Then I became a sports agent in the US. So I had no idea that person like me would come, or we will be in the villages of India, and I will be able to start a hospital. Like a sports athlete would able to run a hospital. I never even had a dream like that in my life, because I never thought about those things. And actually pandemic really opened up to our healthcare. Especially I live in state of Maharashtra. My hometown is about 6 hours from Mumbai city. So the first time in my life, I realized that 70 square kilometers from my hometown, we don't have a CT scan, we don't have MRI. It just opened my eyes by looking at, like, okay, I knew probably this was there, but it never came into our attention till the COVID hit. Now everybody's going, I'm talking about the second wave, especially in March and April, everybody was looking after this HRCT scores, this CT scan. You have, out of 25, how much you have, and people are going crazy. There is no public, there's no private. So for 2 hours, the patient has to drive an ambulance, which doesn't have a ventilator, which that person has to go from the village to the district headquarters, and then they get your CT scan score. There was a time that you had to wait 2 days to get your CT scan because there was a large queue and numbers. In Maharashtra, the numbers were going up, up, and up. Unfortunately, so things were going through like this, and then you are in the middle of it and you are running a hospital. You just don't know how things are going to be. You just don't know who will be living for tomorrow, who will not be able to do that. And there was a such time when I felt like, when I this started in COVID beginning. I'm talking about last year, 2020, in March and April, when the entire country was in lockdown. And even I never thought that, how the situation is going to be the second. We always thought that, okay, after 3 months will be better. I think things will be better. Things will open up. But all the sports facilities were closed, which I run. Everything was closed down. And then we realized that there is no chance that we are going to get all this thing opened up in next 4 or 5 months at least. And now we are in 1.5 year crossed, and we are still under kind of a special type of a type 5 lockdown. So when that thing was happening in beginning, I decided, why don't we, as my team, Mandeshi, and we work with the immigrants. We decided to give them food, as the entire country. A lot of people were doing that, right? Giving them rations and food, all those things we're providing to the underprivileged communities. Now, when we are doing that, we also realize, what if the COVID comes into our district? This is, I'm talking about a year and a half ago, in March and April. So are our government hospitals, are they capable of handling something like this? And we had no clue about how the COVID reacts, how it affects your lungs, nothing. So we decided to give PPE kits and N95 masks. So in that time, how in India also rates go crazy. I remember in March, the PPE kit cost was about 1,300 to 1,200 rupees each. Now that has come down to almost 100 rupees. So you can see the rate from 1,300 rupees to 100 rupees. So we provided about 10,000 PPE kits to the government, of district government. And of course, we had funders who were giving us that funding to provide all those things, sanitizer, N95 masks. Then from there onwards, we decided, why don't we also do rapid tests? When it actually hit my region, we decided to do rapid tests of the people. So in the beginning, we did 5,000 rapid tests, and people were scared. People, like including my family members, my distant relatives, everyone was scared because they didn't know how it's going to react. They would have no clue about how, do we even have a hospital? So when that moment came that we found a couple of COVID patients in my district, that's where we decided that my region doesn't have a COVID hospital. It doesn't have a CT scan machine. It doesn't have an MD doctor. So if those things are not available, how are we going to go to Pune for 4 hours away and probably stand in a queue to get admitted in the hospital? That's not an option. So I had a meeting with the district collector, and I said, okay, I can raise a fund and let's figure out how can we open a hospital. So we decided to use 40-year-old hospital, which was closed down. And we literally found snakes in that hospital when we were cleaning up. We decided to use that hospital and clean everything, do waterproofing. There are no toilets to install toilet. We did public-private partnership model, which is not many organizations have done it because it's really tough, right? For me also, I did not understand how this hospital is going to run. Had no clue. How am I going to get medical MD doctors on the board in the remotest places of Maharashtra? Because we have a nomadic tribal population. How are we going to get all the doctors from Pune and Mumbai to come and work here? And we were able to actually get doctors from there and also get nurses from Kerala at the end of it. But of course, the great part was the district collector was very much cooperative. So there was a good part from the government side. So they provided us the facility. We built the toilets to waterproofing to everything. And then we installed ICU beds. We installed general ward. We did oxygen concentrators, everything, oxygen pipelines and everything. And that time, the district collector and I, we thought that why don't we put an oxygen plant in this? I'm talking about in October, November. And this was an idea. A lot of people said, even funders said, do we actually need it? And this was not studied. So we didn't study about this. We thought, what in case if things go really bad, then we need to have oxygen plant of our own. So we were all able to put oxygen plant, which gives about 45 jumbo cylinders per day. And the hospital which we're running has 50 beds. So it was good enough for our hospital that we were able to provide those oxygen cylinder for our hospitals. Now the hospital started, and the real challenge came in this year, March and April. That's where even after putting up this government free of cost hospital, we are providing food. And we also made sure that in COVID, a lot of people lose their tongue taste, right? When that happens, then you need to have a good quality food. You need to have oranges, you need to have apples, you need to have dates. So you are healthy, you're taking proteins as well on the same time. So we also concentrated more on food. We were able to get doctors, MD doctors, nurses from across and pay them, because of course the government is not going to pay MD doctor what the real salary would be. So I was able to, 50% of HR were taken care of the government, and 50% of the HR Mandeshi took care of it. On the same time, we had all these ventilators, defibrillators, CT scan machine, we installed that one as well. So why CT scan? Why pathology lab? So we did a contract with government that is not going to be only for pandemic. If we will work, if you put this hospital even beyond pandemic, if you give the orders to doctors to be in the hospital, even when the pandemic is over, so then that can be used. So CT scan be used for HR CT scans and maybe brain accidental, a lot of different things. And the second, the pathology lab, is simple thing, lab reports, right? People don't have to go 50 kilometers by buses, and COVID, you don't even have buses. So how, I never understood this whole part, that how are the government, or how we do expect our people to travel who do not have a car, who do not have a vehicle. If they get COVID, how do they travel 60, 70 kilometers to get to the hospital when you don't even have a ambulance? So keeping that in mind, we decided now we are anyways starting a hospital, let's do diagnostic center. So now we have a diagnostic center as well. And this is not with the government, this is our own. Only the hospital is with the government, with the partnership. And that also only HR and the facility is there, equipment, half of the HR, and half of the HR Mandeshi pays for it. So that's where we learned that, we don't have, at least I'm talking about my state. I don't know about other states because this is just my observation from my side, that it's not that our healthcare is failed. I feel like we don't even have a healthcare. If those things are not publicly been able to use for normal population, how it's possible? And some things, even some people do have money, but there's no accessibility. Like some of the village people do have money, but they don't have HR, CT or MRI scanning centers. So that is very crucial and important. That's where a person like me, who was an athlete, now thinking about healthcare is our priority, because I've seen a lot of our nurses passed away. The driver who was driving me, I would go in the hospital every single day. The driver who was driving me, unfortunately, he also passed away. So there's so many people around me. And then those people in the rural villages, they have very small dreams. Dreams could be of getting their daughter educated. Dreams could be of just flying first time in the plane. Dreams could be of seeing, there's so many women who have not even been able to see the beaches. So their dreams, they had those dreams, and they, unfortunately, they had to, some of them who passed away in the hospital. So there are every day 5-7 deaths happening. So they would share those things with you. And that is a lot of pain and a lot of grief you face through. So that's where I realized that healthcare is one of the top priorities. And coming back to what Madhur ma'am also said, that women really suffered with employment because a lot of our daily wagers, daily wage doing jobs. We work with a lot of women, women businesses. We have a business school, we have a chamber of commerce where we support women to have access and control over their finances. They can be independent, so they can make their own choices, make their own decisions. Same thing, the sports program we have is for everything similar. Have access and control over finance. I have athletes representing for Asia. I have athletes gone for Junior Olympics, and these are all tribal athletes. Some of the girls who represent for India, but when they come back, they do cleaning of their dishes in the house, they cook food, they go in the farm. So I always feel that they're ordinary girls who are doing extraordinary jobs, and I also feel that they are like a superwoman. Because if I had been on the national level games, I was a professional athlete, and even me myself, I would never do those things because I always feel so much proud. But these women, they have to do it even in spite of being in the top level. So they have been suffered a lot. The girls I know, over 30 of them got married in COVID. They would have not been able to get married. I mean, they would have not been have married just because they're home. They lost the sports. They no have contact with sports. College is done because it's online, and most of the villages, people, government colleges and government schools are not online because they don't have the cell phones. They don't have those infrastructure, digital infrastructure, and even capacity of Wi-Fi networks. So now those girls are not able to go to school. They're not doing any sports. When they see their parents every single day, of course, their parents are wage laborers. Where are they going to get the money from? So I know personally 30 of them who got married who are in our sports program, age of 18, 19, 17. So I feel that is a big loss. Education has been a huge loss. Sports athletes, some of my athletes were in the Asian Games, who were in Junior Olympics. Now they have lost the sports for 2 years. Some of the athletes like Reshma, who used to be a buffalo herder, fifth daughter in the family, runs marathons. She won Pune International Marathon. She won Virginia State Championship in the US, in France, in different places. Now the same girl who earns about 35,000 rupees per month is earning zero for the last 2 years. So that is a big impact. I'm just giving an example of athletes, but of course, a lot of daily wage labor women, and women are suffered a lot in this, especially some of the girls who ended up getting married. So I feel like that is very, very important. Healthcare should be always a priority. Education is affecting a lot with COVID, and every single of us, we need to think about what we can contribute and how we can build structure. So going forward, actually, we are doing a partnership with Georgetown University and then some of the funders from the US, and we are thinking about opening a charitable hospital. Apart from that, we are doing this study with Georgetown on public-private partnership, where how public-private partnership hospital can be built, and not just in Maharashtra, but it can be built in Gujarat. It can be built in country like India, like Ghana, Nigeria. You can see the difference in my public-private hospital, a partnership hospital. We had people coming in from Solapur district, even different district, because they knew this hospital is really good. So if you really pay attention, if you really work hard, and if this can be curable, we can really do this very well. So yeah, I mean, this is just my experience of COVID, and love to hear from all of you.
Thank you. Thank you for also bringing the spotlight on rural sports and especially girls in sports in rural India. Thank you. Thank you so much for bringing that spotlight there. Now, Asha ma'am, we would like to hear from you. As I mentioned at the beginning, Asha ma'am and her team has been a pillar of support to all of us in the crisis. Ma'am and her team are handling series of challenges. One of it is implementing government COVID guidelines and protocols to an educational institution, university of our scale, where we have 20,000 odd students. So we would like to hear from you the kind of challenges of, there are new guidelines almost every other day. There are revisions, there are expert views on whether students should come, not come, or what kind of protocols. So how you and your team are handling this challenge? Especially, it's also a model for other educational institutions. So we would like to know how your team is handling this challenge of implementing a guideline for an educational institution, especially for handling pandemic.
Thanks for having me. Yes, we did have our unique set of challenges when news of the pandemic started, but we started acting in as early as Feb 2000. But some of the challenges, if I could say, one was the massive flow of unprecedented and varied information. We had facts, we had myths, we had social media was just piling onto us, and along with that there was uncertainty and fear of the unknown, because the disease itself was in its nascent stages, so to speak. We were studying the disease, studying the effects and so on. And in that sort of respect, we did have a lot of our student population having anxiety related symptoms and so on, which we I'll tell you in a bit how we dealt with that. The other challenge that we faced was to encourage and inculcate as COVID appropriate behavior, and to sustain that amongst the youth was particularly challenging, because they're very physical in that age group, and maintaining COVID appropriate behavior was quite a challenge. The other thing was dealing with skepticism and dealing with the infodemic. There were a lot of disbelievers. There were a lot of mask rubbishers and things like that. So that was another thing. That was another challenge. Also, like you mentioned, new and developing information, we had to keep abreast of it, and guidelines would keep changing, and we had to just stay with it at any given point. And if you would ask me, our challenge now is to see how we could go ahead and prevent the third wave. So there again, we have a fresh set of challenges that we need to sort of look out for. What we did in our Christ University COVID pandemic response was, we put it down, and we said we need to create awareness and promote COVID appropriate behavior. The second thing we needed to do was provide assurance and avoid panic within the student community, within the staff community. The third thing, and very importantly, we had to formulate and instate our own set of protocols for the university. And we had also instated a protocol monitoring team to see that those were being followed. So it wasn't just there on paper. We had to see that they were implemented, and that's so we set up a team to see that those protocols were implemented. The other part of the response was to look at vaccination drives and to actively promote COVID vaccination drives, because until each of us is safe, nobody is safe. So the idea was that everybody should get vaccinated at the end of it. We also provided additional support, and that's where my team, the Center for Counseling and Health Services, really stepped up its game. And in addition to that, university took part in a lot of outreach programs. If I could just tell you briefly how, since this is related to how we used media, we used a lot of social media, Facebook, WhatsApp, to reach out to our students in as early as Feb 2020. We also started something called the Crises Vibes, which the Center for Counseling and Health Services gave out nuggets of information every week. So every Monday, if the student opened his or her email, she would get a message about the pandemic, some sort of information about panic attacks, about mental health, and so on. So that was the Crises Vibes campaign, which we started back in the beginning of the pandemic, and it continues till today. Every week, a letter goes out from our department. And our department is a group of about 12 counselors, a medical officer, and we have about 5 nurses on campus, just to give you a little background. We also did extensive poster campaigns. So there are posters everywhere, beautiful, colorful posters everywhere, to sort of, again, promote COVID appropriate behavior. And we had, instated signages and in lifts and so on. We had 2 extensive documents, which I'd like to just talk about. One was the SOP for the prevention of COVID-19, and the other one was comprehensive guidelines for campus instruction. So we started preparing for when the students came back after the first lockdown. And that was very important, because it was the sort of the run up to the second wave. And it got very tricky there, because so we had to have these protocols in place. And these 2 documents, they're up on the website. They're very exhaustive, and they have guidelines for each department: the facilities department, the security personnel, the staff on ground, the housekeeping staff, as to how, when, where, the whole thing. It's quite exhaustive. And so we were able to keep the campus more or less safe due to these action plans that we put together. For example, if a case was reported, students would evacuate immediately. The security personnel would come in, seal the classroom, fumigate, and seal for 48 hours. We did extensive contact tracing, and those were also documented. And then the health center would follow up these cases until such time as the student or whoever it was became negative. So we would do that as well. Like I said, there was a protocol monitoring team to see that these protocols were sort of followed, that there were no defaulters and so on. And this team had people from everywhere. We had faculty, we had staff, we had students, and we had student council representatives and NCC cadets, because we went under the premise that they were peer influencers, and therefore it was important that they be on our monitoring team, and they did an absolute fantastic job of it. The CCHS, my department, the Department for Center for Counseling and Health Services, we did a lot of online programs which were health related, mental health related, and COVID related programs. We even did gatekeepers training on suicide prevention, mental health, staying safe during the pandemic, looking after your health, your mental health in the pandemic, watching for the second wave. A lot of COVID related online seminars and webinars we've done. So that was another way to see that the right information was going out at the right time. That was one way to combat all the negative or the false propaganda, so to speak. The other thing we did was provide additional support. Our counselors were able to give one-on-one personal counseling to any student who asked for it. Our phone numbers were given out, and one-on-one counseling was given. Medical consultation and treatment, we were able to manage. I was able to manage quite a few patients who were fit for home stay. Yeah, and we had nurses following them up and until such time as they became negative. In terms of providing material help, the university was very generous in providing laptops and tabs to anybody who asked for it. Fee waivers, paying of medical bills, recharging of mobiles, all these were services offered through the Center for Counseling and Health Services. Quickly about our vaccination drives, we've done about 5 vaccination drives since about April. That's on an average 1 vaccination drive a month. We've vaccinated so far over 2,000 students and staff, but we've got a long way to go. And we're not going to stop until every single one is vaccinated. We also did a couple of outreach programs, as in packaged meals for the marginalized, the hospitalized, packaged refreshments for frontline workers at hospitals, providing financial aid to medical institutions. We did a blood donation drive during the lockdown, and we tried to time it such that, because once the student was vaccinated, he couldn't give blood for a month. So we had to sort of, time it appropriately and so on. Well, yeah, that's about the gist of, I had so much to say and I'm trying to condense it all, but that's about our COVID-19 response.
Thank you, Asha ma'am. It also tells us how prepared is the campus for the students to come in. Thank you so much. It's indeed, I'm definitely builds in confidence. So quickly, I have one question to Shailaja teacher, and then we have list of questions coming in from our audience, and I'll start taking each those questions. But first to Shailaja teacher, one question. What learning from the series of disasters that have been handled, whether it is man-made or natural or virus or whatever, the policy interventions that you would like to suggest, because you have been talking about public health, how important to improve our public health, but what is the policy intervention that you would like to suggest to the state as well as to the center government? Because you have worked closely, and the state model has been appreciated, and so over to you, ma'am.
It's okay now?
Yes.
It's a very important question, I think so. because without changing the policy, all the countries throughout the world, we cannot the problems of this pandemic or natural calamities, etc. They are coming one by one. Definitely, they will come because the viruses are there in the universe. They are living with the human population. They are living with us, and sometimes they become irritated, and sometimes they become dangerous. Otherwise, they are living with us calmly, and the other hurricanes, everything will come, climate and other things. And we should have what is the solution of these problems and how we can change the number of lives. The most important thing is to save the lives of human beings. That is the most important part. And how can we save the lives? And we should have to work hard and we should have to invest for that. Especially when I am dealing, always I was expressing this idea that our central government and state government should invest more money in public health system. The pandemic is a litmus test to the governance system throughout the world. Wherever the investment in public sector is high, there you can see that we can tackle the problem or we can save more lives by providing them proper treatment and proper hospitalization and proper oxygen supply, everything. But wherever we are not implementing the public health system and invest in the public health sector, there we find the difficulties. Thousands and thousands of people died without getting oxygen or without getting even a single medicine or any kind of consideration. They died without any help. And in our country, India, I think the central government is investing only 1% of the GDP in health sector. That is too low. That is not sufficient. 1% of GDP in health sector. And we should have to invest more than 10% of GDP. Some countries are investing more than 20% of their GDP, gross domestic product, in health sector. But investing in health sector is not only the thing. We should have to utilize and we should have to plan with that money for the health of the poor people. All the people should get a share of the health assistance, or all the people should get quality treatment and also the affordable treatment. Our slogan is that in Kerala, we tried to give free treatment to all the people during the pandemic season. All the other time, any time, we are giving affordable treatment to the poor people. Last 5 years, when I was health minister in Kerala, our government declared some special plans for the poor people, and we announced an insurance program for the in health sector known as Karunya Arogya Suraksha Paddhati, through which we are giving health assistance, free assistance to 42 lakhs of Keralites. And we are now aiming to give 50% Keralite free treatment for any disease and any season. And during the pandemic season, we gave complete free treatment for more than 80% of the population. And we improved the health sector also. But we cannot improve the health sector with the money shared by the central government, because we are getting only the percentage from the 1% of the GDP. That is not sufficient. In Kerala, last 5 years, we adopted another method that, I think you all heard about the KICBI, Kerala Infrastructure Investment Fund Board. That is a loan from some agencies, soft loan, and we distributed that amount to health sector, education sector, etc. And in health sector, we got more than 3,000 crores of rupees to improve infrastructure and also to more modern equipments in hospitals, and that helped us very much. And we improved the whole government hospitals and we have very good modular operation theaters and very good isolation wards and also very good wards for the treatment. And we improved the gynec department also, and that we have to give that money back. The government should give more share to improve this. Plus, in some area, that is the in the gynec section or in the women and children health system, they give some money for improving the theater or improving the labor ward, etc. The Lakshya project, Lakshya quality. That is a very good program, and we implemented that in Kerala also. But that is not enough. And during the pandemic or any disasters like this, we have the people. In Kerala, our Chief Minister announced the 20,000 crores package during the COVID season. When the COVID occurred here in 2020, we announced, I think January, it is true that January 30th, the first case was reported here. And January, 2020, March, April, we declared the 20,000 crores package to the poor people. We were supplying the cooked food through the community kitchen to the patients and also the bystanders in the hospital. And we were also providing food kits to all the families without the discrimination of rich or poor in the lockdown season, lockdown days. We provided or we supplied the food kit to all families in Kerala, and we provide non-communicable disease medicine for blood pressure and diabetes and that kind of diseases. We supplied medicine free of cost in the doorsteps. Our ASHA workers and our Anganwadi workers supplied the medicine for the old ages and for the needy people. And we were able to control the diabetes and hypertension, etc. during the pandemic season. And that also reveals that we should get more money and more consideration to the public health system. That is the policy. That should be the policy. The other thing is the participation, that we should have to participate each and every stakeholders in this work. And in Kerala, we arranged a joint work, a collective work to tackle the problem. Each and every department, not only health department, but police, revenue, and food supply, every department worked hand in hand. And everyone have their own responsibilities. And we examined the responsibilities properly. Each and every day we have meetings and evaluated the work rendered to the departments. That is and the other thing is the decentralized planning. And we cannot do anything from the center. We can plan things from centralized planning is the better thing. But the implementation, we should have to decentralize the implementation policy. And with the help of this local self-government, each and every wards, with the help of volunteers and field workers, we should have to implement our policy. For example, in the mental health sector, we have 3,000 mental health volunteers or counselors, and that is not sufficient. But we entrusted the work to the ASHA workers, Anganwadi workers, etc. We trained them properly, and each and every houses, the Anganwadi workers called all the people who were resting or who were taking rest or who were quarantined in their home, and they called them and they consoled them and they asked them whether they have anything they want to have, and we supplied them there. And that kind of consideration is also a very that is the need of the time. And that kind of policy we should have to include in this action plan. And the most important thing is the people-centered method. We should make awareness, and we should collect the capacity of all the people. And we called for a COVID brigade. Thousands of young people registered in that COVID brigade. and they worked as volunteers for the COVID work. Someone worked in the community kitchen, someone worked to visit the home as courts, and the doctors and nurses who have the certificate of doctors and nurses, they worked in the COVID first line treatment center, COVID second line treatment center, and domiciliary care centers. They worked hard without getting any salary. They worked hard, and the participation of the people, that is the most important thing during the disasters and the calamities and the hardships. That is the thing. The important thing is we should have to invest public system. Then only we can build up the public health or public school or public education system or anything. We should have to build up, and that will help us during the hardship days. And that is our policy in Kerala. And central government should adopt more people-centered policy in future. And the world itself should adopt this kind of policies.
Thank you, ma'am. There's one question from our audience to you, so I'll just read out that question, and I'm sure the comparison, comparison of how you handled COVID and how the current minister would be handling COVID, I'm sure that is bound to happen with the kind of popularity you had. So the question is, do you think the current situation in Kerala could have been prevented taking the right measures as you did during the first wave? So I'm sure you would have come across a series of such questions. I'm sure media is also talking about it. And also another question, that having so much of information from the first and the second wave, the third wave should be less scary. What do you think about it? These are two questions from us, from Samhita and Leander Lingam. Over to you, ma'am.
Yes, the no minister is also working hard. When I came to office, or when I became health minister, I was newcomer at that time. We should have to study the situation, and we should have to act properly. That is the thing. And she is also studying, and I think she can also work as much as me. And during the first wave, we can contain the virus in proper time. And it is through the collective work of the, I have a very good team with me, and that team worked hard. I always saying that the real heroes are behind the curtain. That they are the healthcare workers. Without the help or without the hard work of the healthcare workers, we cannot achieve anything during a pandemic season or any health problems. And the new minister and the government is also working hard to tackle the problem current days. And the question about the third wave, I think there is no waves described in any health science or in literature of health about the waves. But we are saying it is a wave because all the pandemics shows a curve that sometimes it will peak and sometimes it will diminish. And we can say it is a peak. And in that sense, the first wave occurred during 2020, that is October, November, etc. And we can slow down the peak by scientific methods, and it flattened. And again, it peaked. All the people said that the first wave, it will go up to more than 20,000 to 40,000 cases per day. But we worked hard and we decreased the number, and it peaked to 11,000 per day, 1 or 2 days. And then it diminished and it flattened, and it go below 500 per day. The second wave during this season after the election, I think there is a Delta variant also it occurred. The COVID-19 virus, SARS coronavirus 2, is showing the genetic variations occasionally. And now a Delta variant is here, and it is more spreading type, and its incubation period is also too low. I think 4 or 5 days. The other case, 14 days is the incubation period. Now it become 4 or 5 days. Scientists are saying like that. And the infection become greater. And we should have to act according to that. And we are working here, our government and our health minister and chief minister, everyone were working on that. And I hope they can slow down the curve or flatten the curve this time also. They are working hard. And the last question, what is the last question?
Thank you, ma'am. You answered all the questions. Thank you so much.
Okay, thank you.
Okay, over to Madhur, ma'am. Madhur, ma'am, you have a question. How pertinent is data? This is by Sohini Banerjee, and the question is: how pertinent is data becoming in a pandemic of state-sponsored misinformation and propaganda that is affecting people's life in all aspects?
Okay, great. I'm not sure I agree entirely with this state-sponsored nature of the allegation, but I will answer to how important data has been in reporting this pandemic. I would say it's been all important. What data has been available has been extremely important. What has not been available has also been very, very important. And why do we need data or information, correct information, especially in the pandemic situation? We need it for people to be able to make the right decisions, for you and me as citizens to be able to decide for ourselves. Shall I get a vaccine for myself? Shall I send my child to school? These questions can be answered much better when we have the correct data and correct information to base our decisions on. Data is also critical for fighting misinformation. When the facts are, when the numbers tell you that vaccination works, and you know that the risks of maybe falling sick due to vaccination are dwarfed when you see the benefits of getting vaccinated, you can counter vaccine hesitancy. You need data and correct information to also build trust. Only when the government is communicating correctly, appropriately, in a timely fashion, for instance, do citizens trust the government to take the right decisions for them. Which vaccines should be made available, when, where, to how many people, at what cost? Should people get vaccinated? Again, is a really big question in many people's minds. What should the public health facilities be spending on? Should it be oxygen facilities or ventilators or beds or at-home care? So all of these decisions can be taken when correct data are available and correct information is available. So I would say data is extremely important. Withholding of data also becomes very important, but that's a separate question, conversation, and I keep my answer. I rest my answer here.
Okay, one more question, Madhur. Just one more question from Rishabh Jaswal. Do you think that digital media is better suited to cover news related to COVID pandemic rather than print and broadcast?
Yes and no. Okay, I can speak from experience. What has worked in our favor, especially during this pandemic, is that we've been able to react with alacrity. We've been able to react very quickly as news has been breaking. So you don't have to wait until the next day's newspaper to get the news out, get your stories out. Also, production times for text-based online publication are much more compressed compared to, let's say, TV production. So it's possible to get stories out very quickly. It's also possible to do long form without breaking, the 600 word or 300 word or 800 word space on the page. So that helps as well. And our forte at IndiaSpend and our focus at IndiaSpend is on long form journalism. Deeply reported, richly reported stories that are told in the number of words that it takes to tell that story effectively and to the best of our abilities. Yes, that's how I would answer this. It's been a really big plus for us at IndiaSpend.
Thank you. And my next question is for Mr. Prabhat. This is by, the question is from Janvi. Your work sounds very impressive. How did you and the people working with you deal with the setbacks? So this is a question to Mr. Prabhat. This is from Janvi, and a question is, your work sounds very impressive. How did you and the people working with you deal with the setbacks?
Yeah, setbacks are very tough. So to be honest, when I had lost couple of people whom I knew, like from nurses, doctors, and not doctor, but nurses and ambulance drivers and everything. And also people who I didn't know. Like I was just saying that people who are a part of um, people who are part of our program, or people who are just there as the patients. Right? I didn't know them individually, but things they shared with you, things just that you see the 30-year-old dying, you see 25-year-old. So that's really pain. And I had a tough time dealing with it. I didn't realize then, but after now, it's like last month I had to go and do a Ayurveda therapy for myself, to be honest, because and I was in Kerala to do this therapy and everything, because I think it was really, really tough for me to go through that, which I didn't realize then. But after 4 or 5 months, I realized that it's a lot of grief you are carrying with you. And when you see all those horrible stories, and then when you see it in your front of you, where you have two members in the family is passing away and all these things, so that was very tough. So that set back every one of us. But in our organization, everybody's there for you. So when something happens to, we have about 200 people in the organization. If something happens to 199 number person, I'll be there for them. So there for you, there being there for each other is the only key which we always kept with ourselves.
So there's another follow-up question to this, and what this is from Leander Lingam. With all the work you have done, Mr. Prabhat, I wanted to know what support did you get from the world of journalism? So Leander Lingam wants to know, did you get support from media for the kind of work you have been doing, or what kind of support you got from the
Yeah. So of course. So there was a article was written by World Economic Forum on it. Then there was support from, of course, some support from the district government. It was really good because district collector was a friend of mine, and it happened to be, we went to similar school together when we were in the US. So things were like, fortunately, played out to be very well. And then also support from domestic media as well, support from the local media. So it was there because, a lot of people who, especially the domestic media, right, their relatives were admitted into this hospital. So they knew the quality, and all our numbers were there. So if any patient has any problem, I'll give an example. There was a problem of hot water, which somehow for 3 4 days it was not working, drinkable hot water. So the patient called me directly, and it's good. So we know that, okay, so we make sure that it get installed. I think that's the good part about PPP model, public private partnership, because we have proved it, and we are doing a launching of a policy level submission to the state government, that how the PPP model can be workable, how CSR corporates can be, because everybody's scared to put direct or start something directly with the government, because they don't know what the consequences will be. And we were also scared, but I think the pandemic didn't make us think a lot. We just had to do it. There was no other option. Okay. So we are doing those PPP model studies with Georgetown, and we are submitting in November to the state government. So that can be a role model to anyone else across India who wants to start it.
Okay, thank you. Thank you, Mr. Prabhat. Asha ma'am, there's one question. I'm sure this question is from, I'm sure you would have heard this question before. For college students above 18 years, is it really safe to reopen colleges with students coming in from various states and not vaccinated properly? Will it worsen the current situation, or is it smart to move to continue with online classes? I'm sure such queries you receive on a regular basis, more so now when we are planning for an offline mode. So,
well, this query is very pertinent given what we went through in the second wave. Fortunately, the university has left it open to you to make individual decisions. So we have what we call the hybrid system, where you have online classes and you are free to come into campus as you wish. So really, it's up to the individual, and you have that option. I know that, my son is in school and he may not have the option. He's in the 10th standard. He might have to go in anyway. And, something like that is worrying. But for Christ University, there's no such problem in the sense that you do have the option. Other than that, I would just like to say that I think one vaccine, if you're covered by one vaccine, although you are not very much protected, you're about 36-37% protected. If you do get COVID, the chances of hospitalization and mortality are very, very low. if you've had even a single dose of vaccine. Although the rate of infection can be quite high, post-infection, the danger of going into a serious illness is very, very low. So, and also, if you follow the appropriate COVID behavior, in the sense that if you use your mask and keep social distancing, it should be absolutely fine. People like me are going to work. A lot of staff are coming into work. We're extremely careful. What I found with students is that they drop their guard, and so even double vaccinated people like you, like me, are extremely careful. I still wear my N95 to work and so on. So a lot depends on social behavior more than vaccination.
Thank you, ma'am. With this, let's wind up our panel discussion. It's been a great evening. Thank you, each of the panel members, for taking your time out and sharing a very, very important insight to the topic that we have been discussing. Thank you, each of you. Thank you. Over to you, Aparna. Over to you.